Everybody, good afternoon. So today we are going to talk about UTI, urinary tract infection, with amazing Dr. Moira, who is clinical naturopath. Okay, before we start, let me introduce myself. My name is Ange, or Anjali if you like to call me, and I am women's health and wellness coach. Here's Moira, and I am certified nutrition counselor as well as founder of this. Okay, she should be here. It's thinking. Here she is. Hi, Moira. Thank you so much
Hello.
for being here.
No, thanks for having me.
Yeah, thank you everyone for being here. If you can hear us, please give us a thumbs up and we're going to start. So I've just finished talking about myself and I was going to read your bio. So would you like to introduce yourself or you would like me to, can I read it?
You can read it.
My accent might be a little bit different, so it's okay. So Dr. Moira is a clinical naturopath with over 20 years in practice. She has taught in both higher education and private sector holistic education for over 15 years. She runs a busy, I don't know how to say this, genitourinary.
Yeah, genitourinary.
Urinary. Okay, thank you. Focused virtual naturopathic practice in Australia called Intimate Ecology, which supports people with recurrent and complex vaginal and urinary health conditions. She also offers practitioner mentoring and group education with a unique focus on genitourinary.
Yeah, perfect.
Okay, pardon my English health. So Moira completed a PhD at Griffith University in 2023, focusing on a clinical intervention for recurrent vaginal candi,
Right. Yeah, so candidiasis, which is recurrent thrush. Yeah.
candidiasis. Okay,
Mhm.
thank you. In addition to exploring patient experiences and mapping the impact of, okay, you have to say this, a
Fluconazole.
okay,
Yeah.
yeah, on the fungal and bacterial vaginal microbiome, gut and vagina. All right, thank you so much for your help because they were big words for me. Thank you for your patience. All right, so before we start, I just wanted to let people know that this live is not about giving you advice or suggestions or, please go to your health practitioner or you can always reach out to Moira because it's virtual, you help people virtually, right? So
Yeah.
anywhere in the world, you can reach out to her. So, all right. So would you like to add anything else, Moira?
No, I think we're good.
No. Hello, everybody. Thank you for being here. Yeah, Gold Coast Organic Market is here too. Amazing. So, in a very basic way, what is UTI, especially for the women from third world country like myself from Nepal? We live with the symptoms of these things because we are so ashamed of it. We don't talk
Mm.
about the women's health around it. So how would you explain to them what UTI is?
Yeah, so UTI is urinary tract infections. So we're looking at symptoms in the bladder or around the urethra, which is part of the external part of the urinary system, and even right up to the kidneys that involve bacteria primarily that are overgrown and then they cause symptoms. So people can experience frequency of urination or pain and burning on urination. There may also be fever in extreme cases, and people might see blood in their urine. So these are symptoms in an acute UTI that can happen quite quickly and are quite severe and life-impacting. And then people unfortunately go on to experience recurrence with UTI. Often there's quite a high statistic of people that have a UTI, and then because of the changes that we see in the microbiome, because we now know that the bladder has a microbiome and the vagina has a microbiome, and they're both implicated in urinary tract infection. Because of those changes, we see people go on to have, episode after episode, or just an
Mm.
episode that never really disappears at all.
Mm. Yes, that was me. I was talking about it earlier, right? Because mine one was every second week. It would stop until I was taking the antibiotic, and it
Hmm.
would straight out away. It would come back, and I was for a whole year. I was in agony. We couldn't figure out what it was. But anyway, so it's good to know there's like a two types. One is acute, and one is which is recurrence, right?
Yeah, and the recurrent, I mean, in the world of UTI, unfortunately, there's a lot of people that experience recurrent. And so that's been further labeled that we have recurrent and chronic. And then
Mm.
there's a newer term which is called embedded, where we talk about the fact that some of these microbes set up a home essentially and never really leave the bladder and the cells within the bladder. And so it can be a really complex issue. So
Mm.
as you've experienced with a year of symptoms, some people are
Yes.
on antibiotics for very long term or cycle antibiotic after antibiotic. And antibiotics are wonderful in the sense that they can, clear symptoms and make people feel better, but they go on to have impacts on the gut microbiome and overall other aspects of health. So it becomes a really complex thing where you have to think about lots of different areas that might need support to get a resolution.
Mm. That is, yeah, it sounds so complex, but so is there a hope for people like I have, I still get the UTI, but not as like it was, not as
Mm.
symptomatic as it was. So there is a way that I guess, you can make it work afterwards, but you need a support from quite a fair bit of big community, right? The practitioners.
Yeah, definitely. There's lots of things because the longer that you live with symptoms like that, then other parts of your body get involved. So the pelvic floor,
Mm.
sometimes the pain and sensations that you're experiencing more about the pelvic muscles and what's going on there. And so your brain thinks you have symptoms, but it could be something else
Mm.
entirely.
Yes.
And the same that we know from people that have UTIs, that some of that inflammation that occurs at that time also remodels how the nervous system interprets signaling within the bladder. So what that means is that you would have a UTI and there's a whole lot of inflammation that occurs within the bladder itself primarily, and then the body thinks that that sensation is something that it should keep remembering essentially on a nervous system level. And so sometimes working with that signaling or working with the nervous system is part of it. So it's not just
Mm.
about bacteria, it becomes sort of
Mm.
multi-system in a person. And for females in particular, hormones have a really big impact on
Mm.
UTI and UTI recurrency, and we tend to see more recurrence of UTI when people are experiencing changes in their estrogen. And so that might be as they move through their lifespan, or if they're on different contraceptives and things like that as well, where estrogen isn't there, because estrogen is really important for supporting tissues within the genitourinary system, so within the vagina and within the bladder and the tissues around those areas as well. And so if we don't have enough estrogen coming in, we often have tissue that is easier to damage, or we
Mm.
have a change in what we consider to be beneficial bacteria. So bacteria that is protective against UTI and other infections. And they need estrogen also to be able to thrive and
Mm.
survive in that space. And so hormones are a really important thing that are often overlooked, but can make a huge change to how somebody experiences symptoms over time.
Wow, it's like it's like so many things to unpack here. So
Mm.
with the nervous system, when you said that, so when you start getting the recurrent, the UTI, so your nervous system thinks that I'm just trying to simplify this. So thinking thinks that you're getting UTI, but you have to retrain your brain that it's not, or
Yeah, to some degree. I mean, you've experienced those symptoms, so you know how
yes.
much how much worry that induces, and,
Oh, yes, yes.
even and tension. So one of the things I talk to my clients about, when you've got those symptoms and your legs tapping away and you think you're going to wet yourself,
Mm,
some of that is literally your nervous system response. And that one of the things that we notice is when we sit on the toilet and you're allowed to wee, or you're allowing yourself to wet yourself,
yes.
essentially, that those sensations disappear. But that's more about your nervous system, and the nervous
Mm,
system, not just your brain, but how it creates tone in the muscles in our pelvic floor, or how it's telling everything to tense up in that area as well. So it's a really big part of it. And then we end up with these, cycles of worry as well, because people are
yes.
worried about their symptoms recurring, or if for some people sex might be a trigger, and so they worry about if they're having sex, and then everything tenses up, and then we're more
Mm,
likely to also see those symptoms recur as well. So it becomes a really
it's
intertwined
like,
part of your life. Yeah,
yes.
definitely compounds.
Yeah, I had a fear for a very long time that, if I eat this, or if I did that, if I do this, is it going to bring it back? And then sometimes, even if I have the mild symptoms coming, and the thought would make it worse,
Mm.
you know?
Yes.
And so, and later on, I had to keep repeating that, like, you are okay, you're all right,
Yes.
deep
It's
breaths,
safe. Definitely.
Mm,
Yeah,
yeah.
part of, I mean, sometimes when we're working with UTI as a naturopath, when we're working with herbs and we're working with, things that will support the microbiome, and we might be working with general lifestyle factors, but sometimes it
Mm,
requires a referral to somebody that can teach you practices that will make you feel safe, or teach you,
mm,
meditations that will help bring that nervous system down a little bit when you are experiencing minor symptoms, because it really helps to understand what's an infection, or what might just be something that your nervous system is remembering, in
yeah.
general.
And when we are panicking, it even gets worse, right? Because it's the stress is just
Mm.
making the symptoms even go. Yes. Thank
Yeah.
you for that. Yeah. So, what are often treated with antibiotics, but from a naturopathic perspective? What are some of the underlying causes or contributing factors that people may overlook?
Yeah, so I mean, we've mentioned a few of them. And when I sit down with somebody and we're talking about their UTI, we're often talking about their hormones and menstrual cycles to see if there's anything that is irregular that could be predisposing them to the UTI recurrency. We will also think about the bladder microbiome, but also the vaginal microbiome. We know that vaginal health is very much intrinsically intertwined with bladder health in general. So those are things that we will think about. And then definitely nervous system health. And we will talk about gastrointestinal health. We tend to see
Mhm.
some very specific patterns of people maybe that experience constipation, that would end up with more frequent UTIs, for example. So we're looking at exploring lots of different areas. How is somebody's metabolic health doing as well, and what are you feeding and eating in
Yes.
general? Because nutrition, and being, having good nutrition and having good levels of specific nutrients can be really helpful for this particular microbiome to be able to become rebalanced and for the tissues to heal. And when antibiotics are required, obviously they have big impacts on the digestive system, and how that may absorb and supply nutrients as well. And people can cut out foods when they have UTI, which isn't always the best
Mm.
strategy, because then you have fear of
Yes.
foods,
Mm.
or you're taking out the very thing that can be supportive of your microbiome. And so unless something has really strong cause and effect, like sometimes people were like, oh, I drink coffee and I end up with burning pain. If you notice that, then maybe don't have the coffee, but don't
Mm.
take out lots of foods unless, you're working on how you could support your digestive system, working on how you could decrease inflammation, because those things are more sustainable long term, and helping you climb out of the hole of, the compounding
Mm.
antibiotics, and how that can impact your health long term as well.
Yes. The Dave is saying, is this live open to questions? Absolutely, yes. And you can always pop your question in the comment section while we're talking. Thank you,
Mm-hmm.
Dave. And yeah, you so you said that we don't have to take out all the food. right? So because no one could find what was happening, why I was getting so much UTI, so many UTIs. So I completely changed into plant-based,
Mm-hmm.
right? I completely changed into plant-based, and for a few years it felt like it was working, but then of course I start depleting in the other food groups because I
Mm.
wasn't planning well. I just wanted to, so yes, that wasn't a wise thing to do. But anyway, always go to the professional to solve it, right?
Yeah, I mean, plant-based diets are great for microbiomes, but yeah, if you're going to make dietary change, you still need to consider that you're ticking all the boxes for all the
Boxes, food groups,
nutrients. Yeah.
nutrients. Yes.
So, and that's the thing, because a lot of the time there are quite specific diets or food
Mm.
fears for people that have UTIs. You know, I can't eat tomatoes and I can't have spice, and or citrus might be a trigger. And for some people they are, but at the same time, it's the why are they a trigger? It's probably because your blood is quite inflamed, and those things find their
Mm.
way via urine. You know, some of the metabolites of that find their way into the urine and cause that inflammation. So, you know, a longer term strategy is dealing with that inflammation and dealing with those bacteria and thinking about preventative therapies potentially as well. So it's more of a whole body approach to UTI.
Yeah. So instead of cutting it out, you just learn about your body and then about food as well,
Mm-hmm.
right?
Yeah.
Yeah. Welcome, everybody. Thank you for being here. Today we have Dr. Moira here, who is clinical naturopath. So we are just going through the questions, and we're going to ask, what role do diet, hydration? Well, I think we just touched about this food. So to prevent the recurrent UTI, and are there any specific foods or natural remedies you would recommend?
I mean, it is different for everybody because there are different bacteria that can be implicated in UTI. There are some generalities of things that people can pick up and try. I mean, having a good probiotic, particularly if you're needing to use antibiotics frequently, that might be something that's worth exploring. And there are probiotics that are marketed at Urinary Health that have some of the evidence-based strains that we see in the research that are useful for UTI. So those are good first line things, as well as like cranberry you mentioned earlier. You know, cranberry has some evidence as well around preventing different types of UTIs, in particular E. coli based UTIs. So those sorts of things are good everyday sort of insurance policies to keep things ticking along in general.
Yes.
Um, and then the bigger, more specific stuff comes with understanding, I think, somebody's particular presentation or what could be going on. You mentioned hydration. I mean, it's a really important factor. Lots of people are really poor water drinkers. And when we're thinking about, you know, if somebody already has a shift in microbes, then not flushing that out might mean that there's more opportunity for that to grow in the bladder itself and cause a UTI. And so if you're a poor water drinker, sensible water intake is a good idea. So usually around 2 litres, depending on what sort of climate you live in. And along with that, you can, you know, think about, you know, whether you've got good hydration, whether there is enough electrolytes coming in and things like that. So those are really just everyday tips. And then the bigger, broader eating well, obviously. There are
Yeah.
some quite specific nutrients that, like people who are deficient in vitamin D tend to have more pain signaling coming from their bladder. And so
Oh,
there are quite specific things you can look at and optimize in somebody's health and immunity that might prevent and support them as well.
yes. I take my hats off to you that you have done a study in this. Every question has so many things to unpack. It's
Mm.
incredible. So Dave is asking, what do you think about new evidence that suggests it's actually the pathogenic that cause brain directly rather than the nervous system response?
Let me have a look at that question.
Yeah, can you
That
see here
cause,
the
I'm not
from
quite sure. Yeah, I do, but I don't understand what you're asking there, Dave. So cause the brain to get involved potentially. I mean, the nervous system is multifaceted. Obviously, it centralized in the brain itself, but also permeates through all the different parts of the body. and is talked to by different signals in the body as well. And bacteria, pathogenic bacteria particularly, do create metabolites that are pro-inflammatory, meaning that will cause more inflammation in an area. And that is a signal that the nervous system picks up on and feeds back to the brain and how it's interpreted. So it's more, I mean, it's complex in that I think that there is that going on, and then there are alert pathways as well. You know, there was a study that came out a few years ago around, not a few, it was only a couple of years ago, around what we call histamine signaling in people that have UTIs in the bladder, and how that sets the bladder up to remember a particular pain signal. But histamine is a neurotransmitter. It's a brain chemical. It certainly interacts with that as well, but it's initiated from the bacteria being present and triggering that. So it's complex. And I think, well, from a holistic perspective, we're thinking about the experiences of a person and how their nervous system has been trained by that. You know, the fact that UTI means pain. UTI means that I'm going to be sitting on the toilet for 5 hours. UTI, you know, in the aftermath of that might mean there's pelvic pain. But also there's obviously a very specific bacterial component that continues to talk. And when we're thinking about the bladder having its own microbiome, so community of bacteria, in the aftermath of UTI, that doesn't go straight back to being balanced. You know, you need to support that. And so there can be ongoing signaling from the microbiome, because the microbes talk to our cells, the cells talk to our nervous system. Like, it's very back and forth on multiple levels in general. Hopefully that helps with that question.
Yeah, thank you, Dave. I hope that helps. And so I was going to say that, so it's not just that you have the 5 days course or 1 week course of antibiotic and then you are fine, right? You have to continually support your microbiome.
Yes. Yeah, because sometimes people will find that they'll have the antibiotics, but they'll continue to experience low-grade symptoms afterwards. And it's interesting to explore that, because it may mean that there is still an ongoing low-grade infection. But for some people, it's more about, it's just the inflammation. You know, we've had a big event that's caused the cells and the immune system to get involved in that area. And so the pain and inflammation that comes afterwards is that then you need to continue to support that tissue that's in the bladder and the tissues in the urinary system to come back down to a normal level of immune activity and a normal level of inflammation. And so, you know, that can go on. In my experience with working with people after an acute episode, you could have, you know, 2-3 weeks of ongoing low-grade symptoms that need to be supported. And the better that they are supported, the less likely we are to see some of this nerve reprogramming going on from those inflammatory signals, because that's the thing, that's the danger response that the bladder has that talks to the nervous system.
Thank you for that explanation. It's like it was just in my mind and now I forgot. But anyway, it will come back to me. So I will ask another question. For someone prone to repeated infections, how can naturopathic care support the immune system and the urinary tract health for long term?
Yeah, so I mean, I think we've discussed some aspects of that, but it's, you know, as a naturopath, I'm realistic. People will need antibiotics if they're experiencing UTIs recurrently. Sometimes the goal is to decrease the need for antibiotics, obviously, or the dependency on that, and also to optimize the recovery post antibiotics and post-infection as well. So we're working on, you know, how can we support the gut microbiome? How can we support the bladder microbiome? And how can we support the vaginal microbiome if that's involved as well? And the naturopathy is, I think, quite wonderful in the sense that you get to assess and talk to somebody about all of those different areas of their health and identify which areas need the most support. And so that can be in the form of dietary and lifestyle and referrals, you know, out to pelvic physios or out to people that work with pain signaling and reprocessing, or working with herbal medicine specifically or nutritional medicine to optimize outcomes or deficiencies if they are there in nutrients, and working with herbal medicine, sometimes with, you know, gentle antimicrobials, but a lot of the time it's still on these bigger things of hormones and inflammation and nervous system health as well. So it's got a lot to offer, and it's not necessarily replacing standard medical care, although some people will prefer to try and, if they notice that symptoms are coming on, sometimes if you act quickly, you can prevent that from turning into a full UTI. And at other times, it's about, working with people over longer periods of time to break their dependency on that antibiotic, because there are some approaches to recurrent or chronic UTI where people are on antibiotics for years, and non-stop, because that's how they find their symptomatic relief. But there has to be a point where they step out of that.
Yes.
And so, using a holistic approach that thinks about multi-body systems and thinks about the overall, health of the individual can sort of optimize those outcomes as well.
Yeah, so instead of just looking outside and giving antibiotic, you will go through the lifestyle, through the whole life of person, how, and that is how you try to find the root cause of it, and then you will find the solution for it, right?
Yeah, definitely. And I mean, with infections, there's still bacteria involved as well. So we're still looking at the individually identified bacteria, and then you can, go out and test the bladder microbiome or test the vaginal microbiome and get a bigger picture of how it's all talking to each other as well. But ultimately, yeah, you're finding out the why. The why is this happening, and what are the outcomes of how it's being treated, and can I support that to improve the body's own ability to sort of get on top of it and reduce it completely.
Because it would be like when I had it for a year, it was just even the confidence to go out without not thinking, of and at one time instead of taking antibiotic, I start taking painkillers to
Yes.
to mask the symptoms, but I didn't know any better. But now I know the naturopath way, so yeah, so people would too. So how do you test the bladder microbiome?
So there are globally different companies that are working with bladder microbiome testing, and it's literally a urine sample. So unfortunately, microbiome testing comes with some expense depending on where you are in the world. Australia has some what we call selective panels, so where you're only looking at quite specific bacteria that are implicated in more recurrent or complicated UTIs. So there is that available. And then a lot of the time in our clinic, we're referring out to testing from the US for the bladder microbiome. But again, you would do that, but you would start with case taking, because sometimes things are a little bit more straightforward and don't need that level of investment, or you might find that there's more information to understand the vaginal microbiome than to understand the bladder microbiome, because the bladder microbiome is not simpler, but it's less complicated, but it does crosstalk to those other microbiomes. So sometimes working on the other ones can optimize outcomes, including the gut microbiome as well.
Yeah. Thank you, Kate. I hope that answers your question. So the last one, how can naturopathy work alongside with conventional treatments for UTI, especially for women who experience frequent UTI?
Yeah, so I mean, this is a lot of what we do. So as I said, we're not taking people off antibiotics or recommending that they should struggle through and not use them if they're in an acute infection. But it's about, finding that root cause or that why and supporting them so they have less recurrence of symptoms overall, and supporting the impacts of using an antibiotic on the gut microbiome, because from research we know that people who have UTIs, particularly recurrent UTIs, go on to show quite significant changes to their gut microbiome, and the repercussions of that on someone's health are quite big as well. So we work in that context where we're working alongside that in general. And I mean, there's so many different things that the naturopathy can support and work alongside, in the sense I mentioned hormones. Sometimes the fastest way out of UTI for somebody who is experiencing estrogen change is to use a topical vaginal estrogen, to break that cycle of UTI in general. And so in my clinic, that sometimes I'm like, let's refer you to have some assessment so that you can get vaginal estrogen while we're working on repairing some of this, impact on your microbiome as well. So it's not a one or the other approach. An integrative approach, I think, is sometimes the best way to navigate the maze of UTI. Yeah.
Yes, the solution for the patient. So if anyone has any questions, please put it in the comment section. So while we wait for the question come through, please let us know where we can find you.
Oh, yes. So as I mentioned, our clinic, Intimate Ecology, is an online virtual clinic. So we see people via teleconference. And it's me and two other naturopathic practitioners, and we all work exclusively with genitourinary health, so vaginal and urinary health, and a lot of peripheral areas to that as well. So for both males and females, so and hormones involved in that, and recurrent infections in other areas. So you can find us at Intimate Ecology. So it's www.intimateecology.com.au. And also via Instagram. We have an Instagram profile, which would be what I'm appearing on right now.
Yes.
There's the link in bio there connects through to the clinic as well. So at the moment, my colleagues are taking new clients. My book's open again. Where are we? Late September for an October new client intake. But certainly if you need support, you can connect in and we can get you booked in and working with one of our practitioners.
Awesome. Thank you. So we will put all the information in our content as well. So if no one has questions, you can always directly connect with Dr. Moira. And yes, I think that would be it. But it is such it's only, when we say it in an abbreviation way, UTI, but it's such a massive, so many things to look into. And thank you so much for, because I have never seen anyone study specifically in this area. And yeah, I love what you do. Thank you so much for being here today. And thank you everyone for being here. And yes, we'll talk soon and see you everyone in next chat.
Thank you. Thanks, Ange.
Thank you,
See you.
Moira. Bye-bye.
Bye.
Thank you, everybody.